A very good evening, students. So, today we will be discussing one or two more use cases for image classification problem as per the syllabus. And then, like today, I'll complete the third unit also. So, in next class, we shall start fourth unit, which is about the pre-trained CNN. So, we have seen this architecture of CNN in this unit, and we have also seen the major components of CNN, which are convolutional layer, pooling layer, activation layer, and then we have seen that how that fully connected layer works for the classification. And after that, like padding and striding, that also we have discussed. So the last topic we are discussing image classification problem. Mainly, I am discussing the problems in healthcare domain, though this is applicable to all real life sectors. Though this CNN can be used for object classification, object detection of several real life sectors. Okay. So I hope you remember that in last class we discussed dry eye disease detection, and this it was multi-class classification problem. And if you remember, we discussed the four classes: normal frame, breakup frame, blink frame, and noise frame. So given TBUT video is divided into the frames, and frames are fed to that trained CNN, and that trained CNN has to identify whether frame is normal frame, breakup frame, blink frame, or noise frame. So from a series of frames created from a given video, even even if one frame is identified as breakup frame, its time is measured, and accordingly the severity of dry eye disease is declared. So that was use of pre-trained CNN for dry eye disease detection. Now today we shall discuss first how we can make use of the CNN for early detection of hypothyroidism in infants. This is also very interesting problem. And let me tell you that how we got motivated to work on this problem. We were searching a new problem, and we started with some problem in agriculture field. Then due to some reasons, like we found that no, the problems in agriculture are like not interesting, and we dropped working on that problem. Then after we started working on explainable AI, this was in 2019. So we dropped that idea to apply this CNN for agriculture data. And then we thought, let us explore explainable artificial intelligence domain. So we explored it, and then we came to know that, but before we apply this explainable artificial intelligence, we need to solve some problem using some machine learning and deep learning model. Then we consulted, like I am in touch with several doctors, and then we consulted one pediatrician to know, because I got motivated because when my daughter was 9 years old, she suffered from one disease, and at that time we were misguided by physician initially during initial stage of that disease. My daughter was suffering from scarlet fever. It is called scarlet fever. If you search in Google, you'll come to know about it. So she got, when she was 9 years old, she got a rashes on her body, and I consulted physician because she was not 9 years, sorry, she was 13 years old. And then I consulted physician, and then she told me that physician told me that she's suffering from measles. Then I told her that we like she has my daughter. Had already taken that measles vaccine, so she should not suffer from. But then she said that exceptional cases are there, so she's suffering from measles only. And then they recommended us that antibiotic and some other medicine. So my daughter was taking that medicine for 2-3 days, but she was not recovered, and rather that fever and rashes, they were increasing. So then I thought, let me consult pediatrician only. And then I consulted pediatrician, and then I came to know that it was not measles, it was scarlet fever, and which is very rare disease, and it is a life-threatening disease. And then doctor said that you should have come earlier because it is dangerous, and usually this disease happens in kids when they are in age 9 to 13. So, and she was 13 only. So it was our like good luck that we consulted pediatrician and she got right treatment and she recovered. But then when I wanted to work, when I consulted pediatrician, I told him story of my this my daughter, and then he advised us to work on diseases that fall in one category, and that category is like papuloregular uh, that rashes. So there are different kinds of rashes, and there is a specific category of rashes. And under this category, around 10 to 15 kinds of diseases fall. Like dengue also falls under that category, measles, chicken pox, then rubella, then scarlet fever. All these diseases, they fall under the category of that rashes. And because all these diseases, in all these diseases, kids, they get rashes on the body, red color rashes on the body, but only difference is that rashes have different texture, different size, different intensity, different color. So that way rashes differ in all the diseases, and only expert doctor can manually diagnose that which kind of disease it is, whether it is dengue, whether it is scarlet fever, whether it is measles, whether it is, because symptoms are almost similar and all these diseases, they fall under one category. So we started working on this disease initially before this hypothyroidism. We started working on that disease. We wanted to classify. We thought of this, that we can, like, doctors can take picture of this rashes, and this picture should be given to the trained model, deep learning model, and this trained model should identify that whether this is measles, or it is scarlet fever, or it is chickenpox, so that patients and patient parents will not be misguided as we were. So we thought of that. But again, the problem we faced was when I consulted other pediatricians, when I consulted this pediatrician, and the problem we came, like, the this is the most uh, uh, like, this is the challenge in healthcare when you work on any disease, that we started working on this, but then from where to collect the data, because we need to train the CNN with the images of measles, with the images of dengue, with the images of chickenpox, with the images of scarlet fever. And there was no reason for doctors to collect the pictures of such patients. So they were saying that even if you give us 1 year, you will not be able to get sufficient data, because if we want accurate output, we should have balanced data for all these categories, and that too in sufficient amount. So after working on that problem for 2 months, we dropped that idea that we will not be working on this because we will not get sufficient data. Then I had again like 2 3 more meetings with that pediatrician, and then once he called me in one pediatrician meeting, which happens in South Gujarat. And then he introduced me that I worked on, so like, in healthcare domain, and I apply AI to solve real time problems in healthcare domain, and so and so. So then he introduced me, and then I had one meeting was scheduled with one pediatrician. And in fact, it is further specialization in pediatric line, and that was pediatric endocrinologist. So meeting was arranged with a pediatric endocrinologist, and that pediatric endocrinologist suggested us that we can work on this problem. Why we should work on this problem, I'll tell you during the discussion of this problem. And that too, she suggested us to work on hypothyroidism in infants, because hypothyroidism occurs in all age groups. She suggested us to work for infant. So I'll tell you why she suggested us. In fact, there is a group of pediatric endocrinologists who suggested us to work on this problem. Not only she, but a group of pediatric endocrinologists. So I'll tell you why they suggested us to work on this problem. Let us start discussing on this problem. What is hypothyroidism? So you might be familiar with this word hypothyroidism, but you might not be exactly knowing what this hypothyroidism is. So thyroid is a hormone secreting gland. It looks like this. It is a hormone secreting gland which influences all metabolic activities in our body. And it is a butterfly shaped. Here you can see that it is a butterfly shaped gland that is located low on the front of the neck. Okay, so that is a thyroid gland. Okay, now what is hypothyroidism? So deficiency of thyroid hormone leads to hypothyroidism. in every age group. Okay, deficiency of thyroid hormone leads to hypothyroidism. Now, deficiency of this thyroid hormone at birth, it leads to hypothyroidism in infant. So see this, in infants, there may be deficiency of this hormone at their birth time only. And that leads to hypothyroidism in infants. So if this hypothyroidism, if infants are suffering from hypothyroidism, severe complications, like these are the complications, severe complications such as, okay, these are the, let me tell you that there are different types of disorders related to that thyroid, and these are the different types of disorders, and among them one of the disorder is hypothyroidism. It may be thyroid nodules, hypothyroidism, hyperthyroidism, goiter, thyroiditis, thyroid cancer. So these are the different types of dysfunctioning of thyroid. Okay, now if we, irrespective of age group, these are the general complications. The above box represents the general complications in all age group. So if a person is suffering from hypothyroidism, person may have these problems: goiter, heart problems, mental health issues, then peripheral neuropathy, and so on. Okay, so these are the general complications. But if this hypothyroidism occur in infants, they have additional severe complications. Severe complications such as mental retardation, slower linear growth, loss of IQ in infants, poor muscle tone, then speech disorder. They may get speech disorder and vision problem. So these problems may arise in infants due to hypothyroidism. Due to this severe complication, infant's growth may not proceed as a healthy infant. And once they enter in such problems, almost these problems are unrecoverable. Like suppose infant gets mental retardation, then almost it is impossible to recover infant from that mental retardation. So this disease is considered very serious in infants when it occurs in infants, because infant's growth may not proceed as a healthy infant. So and hence it is desirable to diagnose this hypothyroidism in infants in as early as possible stage to protect infants from such severe complications. So this should be identified in early stage. Okay, but the symptoms of this disease are not proficient during the early stage, and that's why doctors are sometimes not able to diagnose this disease during the early stage in infants. Moreover, the symptoms of this disease, some of the symptoms of this disease are considered as the normal features of the infants, or some of the symptoms of this disease are similar to the symptoms of other disease. I'll tell you which are the symptoms and how they are similar to the symptoms of other diseases, and that's why they are overlooked by the doctors, because the symptoms are similar to the symptoms of other diseases, and those other diseases are diagnosed by the doctors. Okay. So let me first tell you that how this disease is clinically diagnosed and what are the disadvantages and why this should be computerized. Okay, what was the motivation to automate the hypothyroidism detection in infants? So this is the approach used in clinics to diagnose this disease in infants. History of the infant is collected from the parents. Okay, that what is the sleeping time of the infant, uh, then whether infant is feeding slow or not. So some history is collected from infant's parent. After the history is collected, physical examination is carried out by doctor, and physical examination is to observe the symptoms in infants. Okay, so this process, actually, this clinical process is lengthy diagnosis process. Based on physical examination, some imaging test or blood tests are recommended for the infant, like T4 test, like hormone test, PSH test, or some imaging test is recommended. And when reports come, the decision, the final decision is taken by the doctor. So this is overall lengthy diagnosis process, and diagnosis from physical examination is completely subjective in nature. So like these are the these are the problems. Not only these are not only the problems are also that, as I told you, the symptoms of this disease are similar to the symptoms of other diseases. So sometimes these symptoms are overlooked for this hypothyroidism, and hypothyroidism is not identified when it is in its early stage. So that is also the problem. Okay. So what we thought to computerize this detection, and we thought to collect images of infants suffering from hypothyroidism and images of infants who are healthy, so that we can train our neural network with positive as well as negative samples to avoid accuracy paradox. We collected images of infants suffering from hypothyroidism and also images of infants who were healthy. So our aims were to automate detection of hypothyroidism in infants, especially during the early stage. We wanted to identify, increase hypothyroidism detection accuracy, and decrease diagnosis time. So these were the major goals of this research. And we considered this features of this symptoms of the hypothyroidism. So we considered, you can see that 5 symptoms, and these are facial symptoms. Though jaundice is shown here, actually we didn't consider any other part of the body. Only facial image was considered to train the neural network. So color jaundice, because color of skin. So it is, if it is yellow color, like we know that jaundice is detected. And you see this suppose infant has yellow skin, then doctor may diagnose that infant is suffering from jaundice, but actually it may be one of the symptoms for hypothyroidism. Other features are like puffy face, flat bridge nose with a broad fleshy teeth, and all these features, they can be considered as the normal features of the infant. So that's why these features are sometimes overlooked, because they may be considered as normal features of the infant. This protruding tongue, swelling around eyes, even the swelling around eyes, this tongue, like keeping tongue this way, all this can be considered as normal features of the infants. And that's why they are overlooked many times. Okay, so these features we have considered for diagnosis of automated diagnosis of hypothyroidism. And this was the solution proposed. You can see that this is a training phase. We collected these images from pediatric endocrinologists, and some of the images were given by the pediatric endocrinologist in Surat, and some were given by pediatric endocrinologist in Ahmedabad. So we personally visited her clinic and we collected these images. And then after that, after collecting this, because we asked them, when we visited, when we met them during the first meeting, when we requested them to provide us images, they were like, we don't have any images, because there was no reason for us to collect the pictures of patients. Then we requested them and they collected images over the next 6 months and they provided us, but they did not take images in the, from right angle and with right position, but at least we got images. And then we got images, then we cropped these images, and we extracted face from these images, because we were identifying, our goal is to create uh, solution that detects hypothyroidism from facial image of infant. So we extract facial image from this infant's images, and then these facial images are provided to, they are augmented, because we had almost 150 positive images and 150 negative images. So 300 images we could collect, which is not sufficient, sufficiently large data set. So we augmented it, and with this 2 operations, data augmentation using mirroring operation and data augmentation using color operation. So we augmented data, and then that data was provided to pre-trained CNN. I'll tell you that which pre-trained we use ResNet 50 here, because here also, like dry eye disease detection, we experimented with different pre-trained CNN, and we observed that for this data set, ResNet was giving good performance. So we finally used ResNet in our solution, and ResNet pre-trained CNN was used to extract the features to learn the representations in the images. And then finally, we used classification here, which is binary classification. So now see the difference between previous problem and this problem. Dry eye disease detection was multi-class classification problem because four classes were there. While this is binary classification problem because just train model has to tell us whether image represents hypothyroidism or not. Okay, so only two classes are there based on probability. So this is how we train the model, and after training this model, this train model is used to detect hypothyroidism from the new images, right? So here you can see that suppose we give this input image with which model was not trained. So face is detected and then features are extracted from this face image like color features, shape feature, texture features, morphological features. And then based on these features, this output is given by this train model that whether infant is suffering from hypothyroidism or not, right? So it is likely that infant is suffering from so it now how it saves the doctor's time and how it helps doctors to diagnose it correctly. So if the probability is above 0.5%, then after this, like doctors suggest parents to go for those tests. While in earlier case, like it was completely subjective and manual diagnosis. So even if infant is not suffering from hypothyroidism, doctor may suggest this test. But here, if the probability is above 0.5, then only the test is suggested and final decision is taken. So this helps, like this is a great help to them because it saves a lot of time and it helps them to make accurate decisions. So here you can see that experiments were performed. So these are the real images collected from doctors only. In some of the cases, the it was like model was misclassifying. Here you can see that this image is of healthy infant, but the model was predicting hypothyroidism. Similarly, this is a image of hypothyroidism. Uh, this is the image of infant suffered from hypothyroidism, but model was predicting it as healthy infant. So some misclassifications were there, and we analyzed, we checked, we assessed the performance for different, images which are blur, images which are taken like from the side. We also considered the side view of the images and so on. So you can see this different this performance analysis considering different images. And this was the accuracy. You can see that almost 80%. Fine. But this cannot be considered as the final because this was the first attempt made by us to diagnose hypothyroidism in infants from facial images. So you can say that we opened a new research direction for those who are working in the domain of machine learning, deep learning, domain of data science, domain of healthcare. So we opened a new direction for them, research direction, working on this problem, like trying to detect hypothyroidism from facial image of the infants, right? So this is like one more image classification problem using pre-trained CNN. Okay, I shall not discuss this use case because this is in your syllabus. Only classification problems are included, and this is regression problem. So this is very recent problem on which we worked. We worked this year only. Like we started working on this problem in July 2022, and we have completed working on this problem. In fact, we have completed writing paper also, and we will be submitting it to some good journal. So recently we completed this. This is very interesting problem, but I'll skip this because this is not classification problem. This is regression problem. Okay, so I'll discuss the next problem, which is leukemia classification. Okay. Okay. So I'll skip all this. We got very good results for this. Okay, but let us discuss this because this is again classification problem. Okay. So leukemia detection and classification from whole slide image. This is also very interesting problem, I tell you. Fine. So let me first tell you what is leukemia. Leukemia is a cancer of the body's blood forming tissues, including the bone marrow and the lymphatic system. So these are, I know, medical terms. So you might not be familiar with these terms. It's okay because when you work on any problem, when you apply the CNN or pre-trained CNN on any real life problem, so first you have to get domain knowledge. And then only you can, because until and unless you have domain knowledge, you cannot apply pre-trained CNN or CNN to solve that problem. So always you first need to get domain knowledge. So, like as we were working on this, we are familiar with these terms. It is a blood forming tissues, including the bone marrow and lymphatic system. Okay, so this leukemia is a serious malignancy that starts in blood tissues, especially in the bone marrow where the blood is formed. Okay, bone marrow where the blood is formed. You can see bone marrow on the left side figure, right? So blood vessels in bone marrow. It starts in the bone marrow. This leukemia starts in bone marrow and it spreads to other areas of the body. And this leukemia is considered as a serious issue in modern society because it affects both children and adults, even sometimes infants also. So this is considered as a serious issue. And this leukemia included, this leukemia induced death has been listed in the top 10 most dangerous mortality basis for human beings. So one of the key reasons for it is slow clinical decision making process to identify leukemia, and as a part, as per the report of the National Cancer Registry Program in India, more than 1 lakh people are diagnosed with leukemia every year. So the statistics also state that the cumulative risk of developing leukemia is 1 per every 284 cancer cases. So aim of our research is to provide an efficient deep learning based solution to help pathologists to increase the diagnosis precision of leukemia. Okay, I tell you that how it occurs and what exactly like this, where exactly it occurs and what exactly it is. These are the 4 components of blood. You might have heard these names: blood stem cell, red blood cells, white blood cells, and platelets. I'm sure that you know white blood cells and platelets. So these are the 4 components of blood, and leukemia comes from Greek word white and blood. Glucose means white and blood means hema. So leukemia comes from the Greek words white and blood, and it is immature development of white blood cells. So I hope now it is clear what exactly the leukemia is. Blood consists of 4 kinds of components. One of the components is white blood cells. An immature development of white blood cells causes leukemia. Immature development of white blood cells, it causes leukemia. I hope it is clear now what is leukemia. Okay, so here you can see that these are blood stem cells, which are divided into blood stem cells are divided in 2 major categories: myeloid stem cells and lymphoid stem cells. And you can see that all these red blood cells, platelets, and they are here. These are white blood cells on the sides. So leukemia occurs due to immature growth of this white blood cells, right? You can see the types of white blood cells. So leukemia occurs due to immature growth of this white blood cells. Fine. Okay. Now this leukemia, it falls under 4 major categories. Leukemia may be lymphoblastic leukemia, or it may be this myelogenous leukemia. Again, every type of this leukemia is categorized in two categories: acute leukemia and chronic leukemia. So acute leukemia, this is called acute lymphoblastic leukemia, and this is acute myeloid leukemia. This is chronic lymphoblastic leukemia. This is chronic myeloid leukemia. So these are the four categories of leukemia. Acute leukemia is characterized by its rapid growth of immature cells called blast cells, while chronic leukemia develops slowly over many years. Chronic leukemia develops slowly over many years, and chronic leukemia is monitored for some period of time before providing treatment, while acute leukemia is required immediate action, because otherwise acute leukemia is left untreated, then may result in death within a few weeks. If acute leukemia is not treated on time, then it results in death within a few weeks. So this is very serious, kind of cancer. Okay, and just for your information, we do not need to go in depth in this. These are different types of, this is acute lympho, this is ALL. So these are white blood cells, and you can see that they all are not same. Some of they are dark in color, so they are abnormal. This is abnormal growth of this white blood cells. So when it is ALL, they have specific color, they have specific size, texture, and so on. So based on that, so clinically, doctors, pathologists, they use microscope to analyze this white blood cells. Okay, I'll tell you that how it is diagnosed clinically later. Okay, now you can see that this is AML. Earlier we saw ALL. Now we are seeing AML, and you can see the color, difference in color. Okay, this is 50-60% are occupied for nucleus, like see purple striped rods. Okay, this is CLL. So again, you can see the difference in small round nuclei with condensed chromatin. Okay, and this is CML. So this is how they differ. Okay, so now let me tell you what is our purpose in this research. This research, like we have partially completed, it is still going on. Our purpose is to identify, to detect leukemia, and as well as not only detection, that whether patient is suffering from leukemia or not yes or no. If yes, then classify into one of these four categories, whether it is ALL type of leukemia, AML type of leukemia, CLL type of leukemia, or CML type of leukemia. So we do not only identify, we do not only detect this from this microscopic blood smear images, we also classify it. And that's why the problem I mentioned is leukemia detection and classification. It's not only detection, it is detection and classification in one of these four categories. Fine. So let me tell you that how this is identified clinically and why we thought to computerize this. So for this also we are in contact with pathologists, because they provided us some of the data. Okay, so let me tell you this clinical procedure. Clinically, how this is very painful test, for specifically for kids. Clinically, microscopic morphological examination of blood slides and bone marrow aspiration and biopsy procedures are used for leukemia diagnosis initially. Blood smear examination is the most economical solution for initial screening of leukemia, while bone marrow aspiration and biopsy is a painful or invasive procedure. And so a microscopic morphological examination of blood smear is often the first step in the clinical diagnostic process, despite the advanced diagnostic procedures such as flow cytometry and cytogenetic analysis. Right. So morphological analysis is always rapid diagnosis because it is subject to human. It is rapid diagnosis, but it is always subject to human error, inter-observer variation, and it requires highly trained pathologists. So these are the disadvantages of it. Otherwise, that is the good clinical process to diagnose this leukemia. So overall, uh, the limitations of clinical diagnosis are: manual diagnosis is time consuming, it is subjective in nature, it is less accurate, it is expensive, it is prone to manual errors, and so on. And this necessitates computer aided diagnosis of leukemia to help doctors to diagnose this accurately. Fine. So here you can see that these are the limitations. Okay. And these are the benefits of computer. Now, if we computerize this diagnosis, how we can computerize? How this is diagnosed clinically? Microscope, blood smear, that whole slide image, the blood smear image, it is diagnosed using microscope manually for clinical diagnosis. Now, instead of that manual diagnosis using microscope, that blood smear image, that whole slide image, it can be fed to neural network, and we can first feed neural network with thousands of or millions of such images to train the neural network, and then the trained neural network can be used to diagnose this disease once it is trained. So benefits of computer aided diagnosis would be: it reduces the financial and emotional burdens. It is quantitative and reliable measure of leukemia blast cells. It decreases the amount of repetitive and time consuming work. It is useful for educational purposes also for medical students. Early diagnosis of leukemia would be possible if it is computerized. So many advantages are there. Okay. So here is the problem statement, that suppose we are given a set of n microscopic whole slide images. I tell you how it looks. These are the whole slide images. They look like this. These are whole slide images. So we can have such a set of whole slide images of patients suffering from leukemia, and we aim to develop. So using this images, we can train neural network, because these are the images of patient who suffered from leukemia. So we can train neural network gets knowledge that how the slides look, how this uh, white blood cells look when they are immature, when their growth is immature. So they are trained with the real-time cases, and once it is trained, it can be used for testing. So we aim to develop a deep learning based framework to detect and classify typical leukocytes into leukemia and its subtypes. Here are the specific goals of this research. And here you can see that these are the microscopic whole slide images of leukemia patients. And we segment it, because you can see that we do not need to process the whole image, because we do not need to focus on this thousands of such cells which are there in the image. So we can segment the part of interest, and we can analyze those segmented WBCs. And the segmented WBCs are pre-processed, and then we use GAN to uh, augment the data. Then we use convolutional neural network here. You can see that to extract the features, and as well as for classification using fully connected layer. And here we are using explainable AI also. I am not sure whether you are aware of explainable AI or not, but we are generating decisions with explanations, because to win the trust of medical professionals and to win the trust of patients, it is necessary to use explainable AI for such health such compute such AI assisted healthcare solutions. So we have used explainable AI also here, and then finally detection and classification with explanations. So this is how we have. I have not included results of this because still we are testing it. We have completed majority of the steps of this proposed solution, but we have not completed it yet. So I have not included results. Okay. So this is fine. That was about the that is about the this another image classification problem. So we have discussed three image classification problems. One is dry eye disease detection, second hypothyroidism detection, and third leukemia detection and classification. Now, if you have any question, I can take your questions before I start the fourth unit. This is the end of the third unit. So I would like to take your questions before we move forward. And I would also like to tell you that though this AI is useful, there are also threats when we use AI. Like it's all we always talk about the pros, but we should sometimes know the cons of using AI assisted solutions also. I'll tell you later. Let me first know if you have any questions. Yeah, students. So if you have any questions, okay. Okay, so no questions. And fine, let me tell you some threats also. Okay, do you know any threat? Can you tell me that what could be the threat if you use AI assisted solutions? What could be the threats? Okay, let me tell you. Though there are several benefits of using AI in healthcare, there are several risks too associated with AI in healthcare. And threats may differ with domain. Like if I'm using AI assisted solutions in finance, the threats may be some of the threats may be common and some may be like some are domain specific. So if I talk about the healthcare, because we have discussed all use cases from healthcare domain, I'll tell you a couple of threats that have been identified for healthcare domain when we use AI assisted solutions. One of the biggest risk that AI in healthcare holds is that sometimes the decision given by AI system might be wrong. Decision given by AI system might be wrong. For example, it may suggest a wrong drug, I mean, wrong medicine or a patient, wrong medicine to a patient, or it may make an error in locating a tumor in radiology scale or similar problem. So such error could result in the patient's injury or extremely serious health related consequences. Okay, now this is not only the threat. AI errors are potentially different. Such errors, such mistakes may be made by human doctors also. But errors are potentially different. How they are different? Errors can obviously take place by human medical professional as well. But an error in an AI system could lead to injuries for thousands of patients. अगर डॉक्टर से ये मिस्टेक होती है तो वो एक पेशेंट के लिए होती है, लेकिन जब एआई सिस्टम से होती है तो वो सारे ऐसे पेशेंट्स के लिए हो सकती है, right? So that is the one a big threat of using AI assisted solutions. Okay, the next problem may be another threat posed by AI system is data availability. To train AI system, massive amounts of data from multiple sources, which include pharmacy records, electronic health records, insurance claim records, etc., is required. But this data is usually fragmented as patients often consult different doctors. So this data is fragmented. And because they consult different doctors and they switch insurance companies too. So data gets complicated and less comprehensible. And because of that, the risk of error and the cost of data collection increases. Okay, the third threat can be privacy concerns. I'm sure you are familiar with this, right? Privacy concerns. Many patients, we know that privacy and ethical issues are involved when we are dealing with healthcare data. Many patients believe that exchanging data with AI developers can violate their privacy. Many patients believe that exchanging data with AI developers can compromise their privacy. And this is so because AI has the capability to AI has capability of predicting private information about patients, even if the patient has never given the information. For example, Parkinson's disease could be detected by an AI system even if person has not revealed this information to anyone else, which could be considered a violation of privacy by the patient. So, like, that's why many countries have developed AI policies also. Okay. Uh, okay. I can see some messages in chat box. Health has healthy one could be diagnosed as diseased and may be given medicines that have adverse effect. Yes, Health, we have discussed this threat, right? That such errors may occur. Okay. And then Paras has written that after so many years of constant learning, machine could be better than doctors. Yes, it is possible. But if it's a new case, because we know that even in, for common diseases, sometimes exceptional cases arise. So for those cases, if it is not trained for such unexceptional cases, AI assisted system, AI assisted solutions may produce wrong decisions. Otherwise, if it is trained with millions of records, and I gave you that example that recently once when I consulted that dental ortho surgeon, dental ortho surgeon, yes, I think, if I'm not wrong. So I saw one machine there and it was written on that machine that this is AI enabled or AI assisted, something was written on that machine. So I inquired that why this is so, like what help of AI is taken by this machine. So then he explained me that he was showing me that I consulted him for my daughter, and that dental ortho surgeon. He told me that he showed me that this is the current look of the dental structure of my daughter, and after the treatment, how her dental structure will look, and how her look of her face will also be changed. So he showed me, he just took the picture of his dental structure, and he fed it to that machine, and machine showed us that how she looks currently and how she will look after this treatment. So the doctor told me that using millions of more than 15 million records, this machine is trained, and this is how it is predicting that how her face will look like after this treatment. So then he explained me that this is the machine he purchased from USA, and this is like a company, a name I don't remember, but he told me that this is very popular company for in this domain of dental domain. And he told me that that company collected data over the period of almost 8 to 10 years, and then this solution was developed, he told me. So because they also need to tie up with several hospitals, and as privacy and ethical issues are involved, they also have to collect data from those dentists, keeping all data confidential, patients' data confidential. So yes, after so many years of constant learning, machine can we can't say like machine can be better than doctors, because remember that this AI assisted solutions are not to replace doctors. Never. They are to help them. They are to help them to make faster, cheaper, and accurate decisions. So they are to reduce this AI assisted solutions are to reduce the workload of the medical professionals. These solutions are not to replace them, right? So we can't say that they can be better than, or like they are simply to help them. Like for hypothyroidism disease also, I told you that using this proposed solution, doctor can get initial idea that what is the probability that infant is suffering from hypothyroidism, even if those symptoms are similar to the symptoms of other diseases. So if that probability is higher than 0.5, then doctor may ask parents to go for those imaging test or for a blood test. Fine. So we were talking about the threats. We discussed that errors and injuries, and data availability and privacy concerns, and some more threats are bias and inequality. Since AI systems absorb and learn through the data with which they are trained, they can also absorb the biases of the available data. They can also absorb the biases of the available data, right? So, for example, if the data incorporated in AI is mainly collected in, say, academic medical centers, okay, then the developing AI systems will have less awareness about the patients from populations that do not frequently visit that academic medical centers. And because of that, it will treat those patients who are not regularly visiting academic medical centers. It will treat those patients less effectively because it is not trained with those cases. So this is like biases and inequality in diagnosis. And last but not the least, uh, it can lead to shifts in the profession. So in the long run, the employment of AI systems could lead to shifts in the medical professions, particularly in areas like radiology, where most of the work gets automated. Okay. And this raises the concern that a high degree of employment of AI might lead to a fall in human knowledge and capacity over the years. Okay. So these are some of the threats when we use AI assisted solution in healthcare domain. Any question till this point? Any questions? Okay, everything is clear. So now let us start the fourth unit. Okay, these are the books. Like those who are interested, they can read these books. But okay, now let us switch to next unit. Yeah, I have stopped sharing screen because the PPTs of fourth unit are not added in this presentation. Learning, as name suggests, what is transfer learning? Anyone knows what is transfer learning? Okay, so let me briefly introduce. Transfer learning is a powerful technique used in deep learning by harnessing the ability to reuse existing models. I'm saying that reuse the existing models and their knowledge of new problems. Okay, so this is like by harnessing the ability to reuse existing models and the knowledge of uh, their knowledge of new problems. Transfer learning has opened doors to train deep neural networks, even with limited data, right? So, as I showed you, in both the problems, in dry eye disease detection and in that hypothyroidism detection, we use pre-trained because though we collected data, but that data was not sufficient. Data was limited. So when data is limited, we can use the we can reuse existing models and we can use its knowledge. So this breakthrough is especially significant in data science, where practical scenario often need more label data. So we don't have much. We don't have more data in several real-time scenarios, so we can use transfer learning. So transfer learning is reuse of pre-trained model on a new problem. Reuse of pre-trained model, please understand this, reuse of pre-trained model on a new problem. So it's not like that I can use pre-trained CNN only for medical domain or only for finance domain or only for agriculture domain, any new problem. Reuse of pre-trained model on a new problem is known as transfer learning in machine learning or deep learning. A machine uses the knowledge learned from a prior assignment to increase prediction about a new task in transfer learning. And you could, for example, use the information gained during the training to distinguish beverages when training a classifier to predict whether the image contains cuisine or not. So just an example, right? So that is called transfer learning. With transfer learning, we basically try to use what we have learned in one task to better understand the concept in another. And weights are being automatically being shifted to network performing this different task. So that is called transfer learning. Now, how transfer learning works? In computer vision, neural networks typically aim to detect ages. Please understand. Okay. Initially, I told you that you should have basic understanding of computer vision. In initial few lectures, I told you, right? So in computer vision, neural networks typically attempt to detect ages in the first layer, forms in the middle layer, and task specific features in the last layer. Please understand this. We have learned that there are several layers in neural network. So initial layers, they detect ages. Middle layers, they try to learn forms, and last layers, later layers, they learn task specific features. So the early and central layers are employed in transfer learning. Early and central layers are employed in transfer learning, and the later layers are only retrained. जब हम प्री ट्रेन CNN यूज करते हैं तो हम क्या करेंगे? अर्ली एंड सेंट्रल लेयर्स वी विल यूज ऑफ द ट्रेन मॉडल, और वही प्री ट्रेन मॉडल के जो लास्ट लेयर्स है उसको हम वापस ट्रेन करेंगे हमारे डोमेन के साथ, right? Because that is used mainly to learn task specific features. Later layers, they are used to learn task specific features. So what we will do when we use pre-trained CNN, we train only later layers. We do not train initial and middle layers because they are used only for detecting ages and forms. So we don't need to train them. Right? So it makes use of this last layers, they make use of the label data from the task it was trained on. तो जैसे मैंने ड्राई डिसीज डिटेक्शन बताया, मैंने हाइपोथायरॉयडिज्म आपसे डिस्कस किया, तो उसमें हमने क्या किया? लास्ट कुछ लेयर्स को हमने हमारे डेटा से ट्रेन किया. आगे के लेयर्स को ट्रेन करने की जरूरत नहीं है बिकॉज दे आर प्री ट्रेन टू डिटेक्ट एजेस, दे आर प्री ट्रेन टू डिटेक्ट फॉर्म्स. एंड I hope this is clear, everyone, right? So this is how transfer learning works. Okay. What's the time? Okay, it's 3 minutes are left. Fine. So I wanted to discuss the steps to use transfer learning, but slides. Presently, I don't have slides of this unit in this machine. So I'm discussing orally that what exactly it is. Next time I'll project slides also. Okay, so steps we can discuss. I'll discuss only 3 steps, are 3 to 4 steps are there. The first step is train a model to reuse it. Second step is use pre-trained model. Third step is extraction of features, and then extraction of features. Yeah, the steps are almost similar. Okay. Fine, but we shall discuss this in detail in next class. So if you have any question related to the points discussed today, topics discussed today, let us discuss. Yeah, sharing of studied knowledge. Yeah, Paras has given the answer of my question, which I asked, that what is transfer learning? Sharing of studied knowledge. Correct. Any question? So these days you have been very silent. Okay. Initially you were asking questions, but